But the issue here is that the male-dominated professions are under-recognizing and undervaluing frontline caregivers, be they nurses, midwives, or community health workers. It turns out the math on this is pretty striking. This year, the World Health Organization released a report that said, if you count up the unpaid and underpaid work of community and frontline health workers around the world, most of whom are poor, most of whom are women, and most of them are still unpaid, it turns out that it's $1 trillion. The poorest women on earth subsidize healthcare globally to the tune of $1 trillion with their unpaid and underpaid work. That's larger than the economies of over 150 countries. That's what $1 trillion means. So when you ask why that is, it does come down to this guild mentality that we have to break in healthcare. If we really want to democratize healthcare, if we want healthcare for all, within reach of every last one of us, it turns out we need to help others partake in the work of healthcare. And so, again, with the technology that's new, if we can reshape our policies, if we can hire more of these workers, if we can advance what nurses and midwives do, as well as community health workers, I think we can get very far. And just last month, there's been some momentum around this. 190 governments came together not far from here at the UN General Assembly and made the first declaration on universal health coverage. And as part of that, they said they want to feature community health workers as part of a core part of their plans. Now, declarations are great, but it's not enough. Never in history has power been easily granted by those who have it. It has to be demanded by those from whom it's been taken. So
and
I think that's the key thing that we all have to do now, is really ask ourselves, if as a doctor I've never gone unpaid for my work, why aren't community health workers and nurses given the same recognition?